With a shocking 911 call, a dispatcher pleading with the nursing home staffer who says she won't perform CPR on a patient in trouble. So why didn't she come to the elderly woman's aid? Ron has this incredible story. Hey, Ron.
Well, Bianna, it really is dramatic and it is shocking. It began when an elderly resident of the Bakersfield, California nursing home began having trouble breathing. A nurse at the facility called 911, but when the 911 operator told her to perform resuscitation until paramedics could arrive, the nurse responded that the facility had strict rules that do not allow that, and she was not going to violate them.
Fire department, what's the address for your emergency, please?
What started as a routine medical emergency call soon turned into an intense ethical battle.
They're refusing CPR. They're going to let her die.
87-year-old Lorraine Bayless collapsed in the dining room at Glenwood Gardens, a retirement center and nursing home. The 911 dispatcher tried to give instructions to the caller about how to perform CPR, but the nurse at the facility said it was against facility policy for the staff to do that.
The human being, is there anybody that's willing to help this lady and not let her die?
Not at this time.
No, they won't touch her at all.
The dispatcher pleads with the nurse, repeatedly asking if there was anyone who would perform CPR if the nurse would not.
Anybody there can do CPR. Give them the phone, please. I understand if your facility is not willing to do that, give the phone to that passerby, that stranger that had that sent. This woman's not breathing enough. She's going to die if we don't get this started.
With every passing second, Bayless's chances of survival are diminishing, and the dispatcher's tone turns desperate.
Is there a gardener or any staff, anybody that doesn't work for you anywhere? Can we flag someone down in the street and get them to help this lady?
Bayless was pronounced dead at the hospital. Glenwood Gardens released this written statement. In the event of a health emergency at this independent living community, our practice is to immediately call emergency medical personnel for assistance and to wait with the individual needing attention until such personnel arrives. That is the protocol we followed. But some critics are arguing there are state and federal obligations that the facility did not follow. Many lawsuits and even criminal charges could follow.
Now, what is not clear yet is whether that CPR could have saved the life of the elderly woman. The nursing home did say that while its personnel followed standard protocol, it would launch an internal investigation into this matter. Very sad story.
Really sad story. Thanks, Ron.